My name is Patrick Arbore, and I'm the director and founder of the Center for Elderly Suicide Prevention and Grief-Related Services, which is now a program of Institute on Aging. I first got involved in presenting on sexuality and intimacy in aging probably about 20 years ago, and this was with a colleague of mine from Portland, Oregon, and we did some presentations for the American Society on Aging. And what we realized was that this is an area that was very taboo for many years. And yet we would have older people, kind of offline, talking to us about the importance of intimacy, affection, sexuality in their lives, but didn't feel they could really bring it up in any kind of a more public way. And what we heard, and this was very, I think, stereotypical in a way, is that adult children were very, very against their older parent maybe remarrying if a spouse died or if a partner died, and would be very squeamish about it and promote ageist attitudes. That how could you at your age be dating, as if that's a really bad thing. Something about older people wanting to engage in an intimate way with another older person is considered, again, taboo, with the expectation that older people wouldn't even want that. It's not good for them. And yet research has indicated that when older people are permitted and encouraged to have healthy connections, intimate connections, that their quality of life overall increases. And yet people certainly have heard where even when a couple moves into an assisted living, they may not be able to live together. There's often a fear that owners of these facilities have that if we permit this couple to live together, and let's say they've been married and yet one of the partners has early stage dementia or moderate dementia, that they feel that it's not appropriate for them to stay together. And in some facilities, they're very open to it. So when I'm talking to couples who are at that stage of, wanting to relocate or downsize or be part of some kind of a senior living situation, I really urge them to talk to the owners or the, whoever the admissions person is, to really find out what these policies are about, because will they at some point say you can no longer live together? Connections are what bind us to life, and it's particularly true as we age. But we need to break through these barriers, these blocks that insist that intimacy, sexuality is only the terrain of younger people. I think there are many things that older people need to be aware of as they age. And the area that I find that is most underdeveloped with a lot of older people is that, sexually transmitted diseases can affect older people as well as younger people. Now that maybe the partner has died or the spouse has died, they're dating again, and they're not comfortable bringing this up. And I understand that because they have no place to talk about it. And so people like myself and others who are out there trying to raise awareness have to talk about STDs, have to talk about HIV, because those issues are real. One of the things that I often hear is, I'm waiting for my primary care physician to have a discussion with me. And I say, they're just not going to bring it up. You must talk about it. You must ask the questions. And then what I help a lot of older people do, and I know I'm not alone with this, is to write questions that they can ask their primary care physician. How do we find ways that make sexual intimacy at 75 healthy, pleasurable? And so we've got to ask the right questions. Research is very strong in terms of supporting connections with older people as a way to decrease fierce loneliness, a way to decrease isolation. And that we know older people who are extremely lonely, the data are very interesting in terms of that older person might die prematurely, simply as a result of being so lonely. In any of our programs, there is a real commitment to supporting well-being in older people and reminding older people that they are valued, that they are beautiful, that no matter what the health condition is or their living situation, is that we here at the Institute on Aging, through all of our programs, develop caring relationships that say, you matter. And even in our grief groups, one of the other important features is that when older people or even younger people lose a loved one, a partner, a spouse, to dementia death or a death by suicide or other kinds of issues, what I say to them is that it's important that we talk about the loss of affection, the loss of that intimacy. And I can't tell you how many times older men and older women say to me, no one has asked us that question. And I encourage people that do case management or social work or counseling or grief counseling to make sure that is opened up, because people need to grieve those losses. That's how important intimacy is. We need to honor the loss of it, and we need to support the finding of it.